If we eat more fatty food, then will it affect our health? Because this is being generally said that if we eat fatty food, it will increase our blood cholesterol level and it may result in stroke as well as heart attack. But this is a wrong information. The fatty food increasing our cholesterol and resulting in heart attack is a wrong information. Let us see how. Whenever we eat fatty food, the fat enters our stomach. From stomach, it reaches the small intestine. Second, in the small intestine, it can't get absorbed because it's a complex chain. So it has to be broken down into smaller fragments. For that, it needs the presence of a bile. Two things. One is the bile, second is the enzyme, that is the lipase enzyme. This bile causes emulsification of this fat. That means it breaks this fat into smaller fragments. So once it is broken into smaller fragments, again it gets acted upon by the enzyme that is the lipase. This lipase enzyme, which is secreted from the pancreas, again it further breaks these small fragments of this fat into fatty acids. So once it is broken into fatty acids, then only the absorption of this fat occurs. So what enters our blood is not the cholesterol that you consume, but it is the fatty acid. That is a smaller fragment of cholesterol. That is nothing but the fatty acids. So within the blood, these are smaller fragments, that is the fatty acids, combine forming a cholesterol. So what you consume, it is the cholesterol. What gets absorbed into circulation is the fatty acid. Again, within the blood, these fatty acids combine and form the cholesterol. So the absorption of the cholesterol, that is the absorption of the fatty acid, depends upon the presence of a bile and the lipase. So the quantity of fat getting absorbed is directly proportional to the bile as well as the lipase which is being produced within the body. And if you are consuming 1 kg of fat also, only 50 to 100 grams of fat gets broken down and absorbed into the circulation. So what about the remaining thing? Remaining 900 grams of fat won't get digested, so it gets excreted from our body. Even if we eat fatty food, it doesn't increase our cholesterol level. Even I have proof for this. We have done research on many patients. We have put them on only fatty diet, high fatty diet without the proteins and without the carbohydrates. Still, their cholesterol level remains normal. So, this fatty food is not contributing at all to the cholesterol level as well as to our heart attack. Then what is contributing to this heart attack as well as the cholesterol increase in our cholesterol level? Our body is capable of producing the fat with the raw materials. The raw materials it need is the carbohydrate. When we consume excess of a carbohydrate, it gets stored within our body as a fat, that is nothing but the cholesterol. To reduce the cholesterol, we need not cut down our fat consumption. Instead of that, we need to reduce the carbohydrate input. And also to burn the fat within our body, we need to do exercise. So what is contributing to our cholesterol and heart attack? It is not the fat consumption, but it is the carbohydrate consumption. If you need a precise and scientific information about health, then only subscribe to our channel. Namaste.